Good afternoon, and thank you all for joining me. Today we reach the 1 week mark of the first counties moving from the red phase to the yellow phase of our COVID-19 reopening process. And the second round of counties entered the yellow phase today, bringing the total number of yellow phase counties to 37. Beginning at 12:01 a.m. Friday, May 22nd, 12 more counties will enter the yellow phase. Those counties are Adams, Beaver, Carbon, Columbia, Cumberland, Juniata, Mifflin, Perry, Susquehanna, Wyoming, Wayne, and York. To Pennsylvanians in one of the 49 counties in the yellow phase, I cannot emphasize enough that you should continue to implement social distancing. And that means to wear a mask that covers your face from at least the bridge of your nose to your chin whenever you're out in public. It means to continue to stay 6 feet away from people who do not reside in your household as much as you can. It means to wash your hands and use as much hand sanitizer as you can. It means to telework and use other technology to avoid in-person interactions. And it means to follow the other guidance outlined by the Pennsylvania Department of Health and the federal CDC. This virus has not been eradicated from these counties, and we are continuing to closely monitor new case counts. And as I've said before, if we see signs of new outbreaks, we're going to need to act to prevent further transmission. But if we see a continued decline in case counts, we can lift more restrictions and bring our lives closer to normal. So it's in every single Pennsylvanian's best interest to continue to take social distancing seriously. Now, if you live in one of the 18 counties that remains in the red zone, you may feel disappointed or frustrated right now. When we first began to take action against COVID-19 in our Commonwealth, the virus was ravaging Italy. You've got to remember this. And we heard tragic story after tragic story. At that point, we didn't want that to be our parents or our friends or our neighbors, and so we acted decisively. But time has worn us down. We want to be with other people. We want to feel productive. We want to go to work, to the store. We want to see our friends. And with each passing day, it becomes harder and harder to stay home. What makes fighting a pandemic even harder is that a virus is not like other disasters where the danger is obvious. We can all see storm clouds brewing. We can see rivers swelling. We can see trees bending in the high winds. But we can't see the virus particles in someone's breath or on a doorknob or on a light switch. So it's easy to look outside and see a beautiful spring day and think, hey, there's no danger. But the danger's there. It's real. And we need to take that seriously. The epidemiologists and other staff at the Department of Health have dedicated their lives to tracking diseases. They're professionals trained to analyze not just the pathway of known viruses, but opportunities for spread as well. And I base the movement of counties from red to yellow on their scientific and medical advice. It's not just about the number of known positive cases, although that undoubtedly helps us identify hotspots. But it's also about how people in our communities move about and how they interact. It's about the amount of closed quarters and shared touch points. It's about the likelihood that one case will become 100 cases. We all want our communities to succeed, but we aren't all trained to see the danger of a pandemic. We look out and see the clear skies and the first lasting warm days of spring. That's what we see. Epidemiologists see a single person in a busy store exhale a cloud of virus particles and 7 other customers standing nearby inhaling those particles. Epidemiologists see an essential worker take the bus home to a neighboring county and unknowingly share the virus with a dozen other riders. Epidemiologists see one symptomless sick person sitting at a table in a restaurant talking to friends, having the droplets in their breath spread around the dining room by the ventilation system. As the leader of this Commonwealth, I'm responsible for the health and safety of all Pennsylvanians. And I can't and I will not let this virus ravage our communities. And so I've got to take seriously the advice of scientists, of medical professionals, and our epidemiologists. And that includes information laid out in the Carnegie Mellon University Risk-Based Decision Support Tool report. We plan to release this report publicly twice a week to help Pennsylvanians understand the risk factors where they live. The metrics in this report help us weigh quantifiable risk factors. But we also rely on subjective information from our epidemiologists and other health professionals. We review each county individually before deciding on placement into the red or yellow or green phases. We look at case counts, modeling, geographic location, contact tracing, and testing capabilities for individual counties, regions, the state as a whole. Yellow counties have been determined to have a lower risk of virus spread. Red counties, on the other hand, have been determined to have a higher risk of virus spread. Now, I understand all residents are eager to get back to regular business operations, and I'm lifting restrictions and will continue to do so as quickly as I think it's safe. But continued cooperation, a united front against this virus, is going to allow us all to reduce those risk factors. That's what's going to let us get more businesses and activities up and running while we protect human life. Instead of feeling frustrated about living in a red phase county or a yellow phase county, consider this. We have saved lives by what we've done. Through our social distancing efforts, we've not only reversed a trajectory of exponential new case growth, we've now cut it in half. And some of the counties that will be shifting into the yellow phase next week eliminated concerns that we had just 2 weeks ago. So please keep up your efforts in the fight so we can continue to add counties to the list of yellow phase. Thank you again for your patience and for your hard work. Now I'm going to turn it over to Dr. Levine for her daily update. Secretary Levine.
Thank you. Thank you, Governor. Good afternoon. Here's our latest update on COVID-19 in Pennsylvania. As of 12 a.m. this morning, we have 986 new cases of COVID-19. This brings our statewide total to 60,622 Pennsylvanians that have tested positive for COVID-19 in all 67 counties. This includes 4,349 positive cases in healthcare workers, 12,937 positive cases among residents of 550 long-term care living facilities, which include nursing homes and personal care homes. It includes 2,369 positive cases that are in the food industry at 150 facilities. Tragically, 4,342 patients who have tested positive for COVID-19 have passed away, and to date, all deaths have been among adult patients. As the governor indicated, across the state, the rate of infection has been declining over the last 14 days. That is good news for Pennsylvania as we continue to move forward to a carefully coordinated, phased opening. Regionally, case counts are trending downward over the last 14 days, but we are still seeing pockets of outbreaks that are of concern. The good news is that the current load of COVID-19 has peaked in Pennsylvania. However, some areas of the state have only just begun to experiencing meaningful declines. However, while we are on the decline, it is not the time to stop our efforts. These efforts will help us prevent a resurgence of the virus and will keep our counties moving in the right direction. Testing continues to increase statewide, with nearly 120,000 tests performed from April 30th through yesterday at laboratories reporting results. And so far, in the counties that have gone from red to yellow, we are altogether successfully managing testing, contact tracing, case investigations, and outbreak responses. Visit our website at health.pa.gov for a breakdown of all of this data, including animations that show the course of the virus regionally. It's important to remember that as counties move from red to yellow, that we still, as the governor talked about, have to be very careful. Yellow means caution. Parts of the country that have moved with a more aggressive approach are actually seeing rises in cases. And we are keeping a careful eye on what is happening in other countries whose outbreaks have subsided to see if they return. And some of them have had increased number of cases. It seems hard to imagine, but it's just over 2 months since Pennsylvania announced its first positive cases of COVID-19. As we open areas of the state, as counties go from red to yellow, in a careful and judicious way, the Department will continue to do all we can to monitor any resurgence of this virus in Pennsylvania. Now, here are my daily reminders. Please wash your hands with soap and water for at least 20 seconds, or the time it takes to sing Happy Birthday twice. And use hand sanitizer if soap and water are not available. Cover any coughs or sneezes with your elbow, not with your hands. And don't touch your face, especially after touching surfaces. Clean surfaces frequently. And if you have to go out for life-sustaining activities, please wear a mask if you're going to come into contact with others. If you have questions about your health, please contact your health care provider. And if you need mental health resources because you or someone you know is experiencing a mental health crisis, please contact the crisis text line by texting PA to 741-741 or call the statewide support and referral helpline at 1-855-284-2494. Again, 1-855-284-2494. For the most reliable information related to Pennsylvania's response, please visit our website at health.pa.gov. And what is most important for Pennsylvanians to remember is stay calm, stay home, and stay safe. And now the Governor and I are pleased to answer questions.
Thank you, Secretary. We have some questions on the new illness, pediatric multisymptom inflammatory syndrome in children. From WKOK, please tell us the latest on your surveillance of pediatric inflammatory syndrome that is related to COVID-19.
So the CDC last night released a case definition in a health alert about this pediatric condition. They are calling it multisystem inflammatory syndrome in children, or MIS-C. Since they've released that case definition, we'll be working with all of the hospitals, but particularly, of course, our fantastic children's hospitals, in terms of reporting through our data system any cases of this condition. With some phone calls that we've made, though, before that reporting starts, we have learned that there are cases of MIS-C in Pennsylvania, but we don't know the details yet until that in-depth reporting will be done through our information system.
CBS 3 and KYW News are asking if you have a breakdown of those pediatric cases by region.
I do not have any breakdown or any details about the cases since it was just done through some phone calls. But as we get more information, official information through our system, now with this case definition, we would be pleased to release whatever breakdowns we possibly can.
From WTAJ. What would trigger a yellow county to fall back into red status?
So we are monitoring very carefully, as we outlined, any potential clusters or outbreaks in all of the counties, but particularly looking now at counties that have gone from red to yellow. So we're looking for new cases, clusters of new cases that could go into an outbreak. We have many ways of doing this. Of course, case reports through our NED system, but also we look at what is called syndromic surveillance. We are able to see in terms of emergency department visits, specific diagnoses in terms of how it's listed as the patient enters the emergency department. We're looking, for example, of course, for a diagnosis of COVID-19, but we might be looking also for a severe cough or pneumonia or influenza-like illness. There's no influenza really now in Pennsylvania. So we have a number of diagnoses that we're looking for to get a head start to potentially investigate any outbreaks. If we have a case, then that individual will be isolated. We will be doing case identification with that person and looking for their contacts. Then we have our staff of contact tracers contact all those contacts, those individuals, and they will be placed in quarantine. And by doing this systematically in those counties, we aimed to prevent any outbreaks that might lead them from going from yellow back to red.
From 6ABC, can the southeastern region move from yellow to June 4th, even if a key metric like 50 to 100,000 has not been met? And what criteria will you have to move a county back from yellow to red, which you just discussed? Would that be an entire region, or would that be just the county?
So again, we really haven't been looking region by region. That would be county by county. So an entire area of Pennsylvania would not go from yellow to red if there was an outbreak that gave us concern in one specific county. If that had to happen, it would be that specific county. And so we are looking very carefully at all of the data, all of the metrics, all of the trends that we've been talking about. Of course, looking at the Carnegie Mellon modeling. We look at other modeling that we get to make these determinations. We, of course, have discussions with the county health departments in the Southeast, and we'll be making those determinations when they're ready.
From CBS 21, what type of gatherings are allowed for counties moving into the yellow phase? Are close activities like 5-on-5 basketball allowed in the yellow phase? And for gatherings that are allowed where social distancing and masks, are they required?
Well, there's guidelines on our FAQs, or frequently asked questions, document available on our website and the governor's website. We're looking to keep down gatherings more than 25 people. And so we do not want large concerts or large gatherings of any type, because that could increase the spread of COVID-19, exactly the way that the governor was discussing. We are not allowing that type of amateur team sports in the yellow zone. That will be for the green zone.
Thank you, Secretary. Our next questions are for the governor. Governor, from WGAL, what is your reaction to the counties who are pushing to move from red to yellow? Please talk about the divisions this is creating between the concern for the economy and the concern for health.
Yeah, it's a realistic and reasonable expression of frustration. The problem is that our frustration has to be directed to the virus. We're trying to keep people safe, and I think when it comes down to the balancing between the economic damage that all of this epidemic, this pandemic has done, versus the health potential that it has, the negative health potential. I think if we look at it that way, had we allowed, say, what happened in Italy or Spain to happen here in Pennsylvania, that would have been much worse for the economy. More people dead, more people sick, more people being given maybe treatment that was beyond the capacity of our healthcare system. That would not have been good for our economy either. The way we did it here in Pennsylvania, I think, has been less bad than the alternative. And that, I think, is what we always have to keep in mind. No one would want this if we had a choice. Unfortunately, we did not have the choice. This virus was imposed on us, and we are all trying to do the best we can given the dictates and the constraints imposed by this virus.
Also from WGAL, what is your reaction to the rally at today's Capitol and your reaction to President Trump's comment yesterday urging you to reopen business?
Hey, this is a democracy, and I think, as I've always said, people have the right to express opinions, and I think the folks protesting wherever they protest, and the president certainly needs to be able to make those decisions. That's what makes a democracy great. I just hope that all of the folks, wherever they are and however they're expressing themselves, are doing so in a way that helps keep other people safe.
From WTAE, is the state planning to pull licenses for hair salons and barber shops that violate your order?
Yeah, I think each of the different businesses is regulated by different things. Sometimes the Department of Agriculture, Department of State, the Department of Health, the Department of Human Services, and they make their own decisions. Again, one of the other things I think we have to be concerned about is what decisions, say, insurance companies, don't have any control over them, what decisions they make in terms of honoring insurance policies where companies have violated the law. Those are enforcement mechanisms that all these different places have in place, and they're the ones that will be enforcing these things.
From CBS 21, Lebanon County's Republican commissioners passed a resolution today moving the county to the yellow phase without your consent. Will you send official notice of action or discuss the loss of funding directly?
Well, again, I think we're focusing on all these enforcement things. I think the unfortunate thing about a decision like that is why anybody would think they can make that. Going to yellow in the face of a virus that's sitting there saying, I don't think you're really ready, it could put the lives of folks in that county at risk. And I think that's something that everybody in public service, wherever they are, at the county level, at the municipal level, at the state level, at the national level, we ought to be really concerned about. Again, the focus on red, yellow, green, we're trying to share with Pennsylvania the best information we have. And as I said on Monday, you ignore that at your peril.
From Fox 56, also on enforcement, the Pike County Sheriff's Office announces it will not be enforcing any violations under the stay-at-home order. What is the state's response to this, and could they be penalized?
Well, again, I don't know I'm not a lawyer. I don't know exactly what role the sheriff plays in enforcing these things. As I say, the enforcement comes from the certificates, the licenses, and even insurance policies. There's a whole myriad of things, and ultimately, though, you're looking at this virus. The virus is the thing that's setting the rules here, not me, not the federal government, not the county. Although it always makes me wonder how somebody elected to public office to enforce the law is actually out there saying, I'm going to break it.
From NBC 10, Governor Wolf, what do you think about New Jersey and Delaware opening up their beaches?
Well, I think I got that question before, and I said, I'm certainly not going to the beach. And I think the concern we all ought to have is again, with the virus, not with the regulation. You know, you go anywhere where you're going to be in close contact with other people for whatever reason. You're taking your life into your own hands. You're jeopardizing your neighbor. You're jeopardizing yourself, maybe your family. And I think you ought to be concerned about that. So personally, I'm not going to the beach.
From CNHI, Governor, school districts are starting to unveil budgets and warning of deficits. Do you still believe that the state will be able to provide an increase in basic education and special education funding?
Yeah, we're working through the budget process right now with the General Assembly, and so I don't have a complete answer for that. But I think everybody recognizes that every organization, every institution, including the Commonwealth of Pennsylvania, is facing dramatic changes, negative changes in their financial situations.
From WLVR, we covered President Trump's arrival in the Lehigh Valley yesterday. Masking has become political, with hundreds in attendance refusing to wear them. This included many state police on site not wearing masks. Do you worry about the message this sends to the public, considering your directive asking all Pennsylvanians to wear masks? And would you enforce state police to wear them moving forward?
I think state police do actually wear masks when they're in close contact with other people. So I don't know. I'm not aware of the situation in Allentown. Again, a directive asking someone to do something is not really a directive. I think what we're all asked to do here is pursue our own self-interest. And that is, if I wear a mask, I'm protecting you. And if I'm protecting you and you're someone that is close to me, a neighbor, a loved one, a family member, a coworker, then that's something I'm doing because I think it's the right thing to do, and I'm interested in making sure that I try to keep you healthy. Ultimately, that's what should be driving us to do things like keeping our social distance, wearing a mask, wherever possible, staying home, no matter whether you're red, green, or yellow.
We have some questions regarding Beaver County. We'll start with the Beaver County Times. Governor Wolf, what information or data did you review that convinced you that Beaver County was ready for yellow after it was the only Western Pennsylvania county left in red last week? And does this mean you're hopeful that the outbreak at Brighton is close to being contained?
Well, the second question, I am hopeful that it's being contained. We obviously have work to do there. But I think Beaver County has made some really great progress. I'm going to turn this over to the Secretary to Dr. Levine, to actually answer that question, to give you the technical details as to why she and the epidemiologists and our model suggested that, yeah, Beaver County was ready to move from red to yellow. Secretary Levine.
Thank you, sir. So actually, looking at all of our metrics, our data, and our models, including the Carnegie Mellon model, but others as well, Beaver County has had significantly decreasing case counts over the last 2 weeks. That has been consistent. And so they met really all criteria to go from red to yellow. We are working very hard with the nursing home in Beaver County to control the outbreak at that nursing home. We have a new temporary manager that was reporting to us and paid by the Department of Health to work with the staff there to oversee things. And in addition, the National Guard is there to help with staffing issues. And altogether, we have a lot of work to do, but we will do everything we possibly can to protect the health of the residents and the staff at that and really all facilities.
Secretary, the next question is back on this issue for the governor.
Yes, sir.
Governor, from WESA, I'd like to ask the governor what changed between last Friday and this Friday to explain why Beaver County is beginning to move to yellow. Is it resistance from local officials or there or anywhere else playing a role in the decision?
No, these are not political decisions. Again, we're all trying to keep people safe, and as the Secretary just said, Dr. Levine just said, we're looking at the data, and Beaver County is doing much better, which means that we think that virus has less of a chance this week than it did last week of actually infecting people. That's what's driving these decisions all across Pennsylvania. And politics has nothing to do with this.
From the Associated Press, we understand that NASCAR is wondering whether it can go through with its scheduled weekend at Pocono Raceway, June 26th to the 28th. Is that something you will allow, and do you have the power to prevent it?
We actually have had conversations with NASCAR, and I told them Pennsylvania is not ready to make a decision yet. The area that they want to have this gathering is actually in the red right now, red zone and red phase, so I told them Pennsylvania is not ready to make a decision.
And from Erie News Now, Governor, State Representative Metcalf is planning to sponsor a resolution calling for your impeachment. And people at the rally were chanting for you to be impeached as well. What's your response to those calls?
Well, I'm, again, not a lawyer, but I can't wait to see the legal arguments that might be forward in that case.
From WEEU, Governor Wolf, some federal lawmakers are saying your withholding of CARES Act funding to counties reopening on their own is something you have no authority to do. The feds are asking you to invest that money on their behalf. Do you have a counter argument or a rebuttal?
They're evidently different ideas as to what the federal government wants us to do. But what we're doing here in Pennsylvania is that the executive branch is working closely with the General Assembly and will decide with them and in conjunction with them how to distribute the discretionary funds.
Our next question is for the Secretary. Secretary, we have several questions about Dauphin County and being able to move into the yellow phase. From Press and Journal and Penn Live, are you able to tell residents what criteria they did not meet to advance the yellow stage, and what do they need to do? How close are they to being in the yellow phase?
Mm-hmm. So, again, the same metrics that we looked at in terms of Beaver County, which had decreasing rates of infection, did not show positive results in terms of Dauphin County. Dauphin County still has significant rates of infection as well as evidence of community transmission and spread of COVID-19. In fact, in the last week, actually, the numbers have gone up somewhat. And so Dauphin County was not in a position in terms of the spread of this dangerous virus to go from red to yellow. It's hard for me to predict when a county will be ready. I think that what the public can do is to follow all of the guidance that the governor has outlined today. Please stay home unless you have to go out for essential business. If you have to go to the grocery store, of course, and get food, or the pharmacy and get medicines. But otherwise, please stay home. If you go out, then please practice social distancing. Please wear a mask. As we've always said, my mask protects you, Your mask protects me, and if we're all wearing masks, then the community itself is protected. The weather has been much better. If you go outside and you're going to see any other people whatsoever, or there's even the possibility that you'll see other people, please wear a mask. And so we all need to do everything we possibly can to prevent the spread of this virus in all of our areas and in Dauphin County.
Secretary, we have several questions about reopening and the metrics of green. We have public source WJAL asking, can a county move to green before all counties are in the yellow phase?
So we've discussed this extensively in previous press conferences. We've discussed this extensively with the governor. So there is no criteria that all the counties have to be in the yellow zone for other counties to go into the green zone. But we have not determined exactly what the metrics are and what we'll be looking at in terms of counties going from yellow to green. But our staff will be starting to look at that next week, and when we have information, we're going to release it.
Thank you, Secretary. Thank you, Governor. That is all the time we have for questions today. For any reporters who we were not able to get to, the Department of Health and the Governor's office will follow up within the next 24 hours. There will be no briefing on Saturday or Sunday. Our regular briefings will resume on Monday. Thank you.